Hi everyone, Patrick Menninga here, spiritualriver.com. I want to talk to you today about prescription drugs and how that's kind of become the new trend in drug and alcohol addiction, that prescription drugs are now kind of the new gateway drug, especially among young people and among teenagers. And then it used to be that an addiction and a career in addiction, if you will, started with alcohol. And then years later, it kind of progressed, and that became marijuana, and marijuana was the new gateway drug. And now it seems that prescription drugs and largely painkillers, opiate-based prescription drugs, have become kind of the new gateway. And teens know that a lot of times a household will have some painkillers laying around that are left over from a previous injury or illness or whatever the case may be, and that those opiates or painkiller drugs can get them high and be recreational. So that's kind of become the new gateway drug, and it's very dangerous because in many communities what's happened is that painkiller addiction has sort of given way to heroin addiction. And so once the painkillers run out, teenagers and younger people are saying, hey, how can I get more of these painkillers? And drug dealers are saying, hey, try some heroin. This is better, or this is cheaper, or this is easier to get, or whatever the case may be. And so it's become a gateway drug largely to heroin. And so we've seen new epidemics pop up, especially among teens and young people with heroin addiction because of prescription drugs and sort of the new knowledge that the youth of today has that these drugs can get them high. It's also especially dangerous for people in recovery who are already recovering from alcoholism, that they may injure themselves at some point in their recovery, or they may have some sort of illness that requires medications, and they unknowingly get hooked on painkillers or muscle relaxers or benzodiazepines or some kind of medication that they weren't necessarily thinking was going to get them high, and it ends up leading them back into their addiction. And so it can be very dangerous for people in recovery as well. There's kind of a gray area with some medications that some medications are obvious. For example, morphine is a very powerful opiate, and most people know, okay, that's addictive and it has addictive potential. And other drugs like aspirin are sold over the counter, and people know, okay, that's pretty safe. You're not going to get addicted to aspirin. But there are some prescription drugs out there in different areas that do different things that are kind of in a gray area. And so that's sort of evolving right now. And we're learning more and more about that and how that relates to addiction and how there's potential for addiction with a lot of these drugs that fall into a gray area. So you need to be careful with that. You need to talk to people. You need to talk to your doctor. And you need to be honest with your doctor about addiction. And there's some doctors out there who aren't very knowledgeable about addiction. So you need to get second opinions, and you need to keep that conversation going, and you need to talk to more than just your doctor. You need to talk to your sponsor and other doctors and make sure that you're keeping that dialogue open and going, because it's very easy to fall back into your drug of choice based on prescription drug addictions that you didn't necessarily think were addictive. So be aware of that, be careful, and keep the dialogue open and going.